Welcome today to today's live webinar with Bill Rawls, MD. Today, we are going to be discussing debunking Lyme misconceptions, what you need to know to navigate chronic illness recovery. I'm Liza Blass, the community manager of the Vital Plan Network. Just a disclaimer as you roll in today and we get started. As always, this webinar is educational content and is designed to support your overall wellness, and it is not to be a replacement for professional medical advice or treatment. As always, seek the guidance of your physician or qualified healthcare provider for any questions regarding your medical condition. Let's go over today's agenda. We are very excited. I am going to introduce Dr. Rawls and tell you a little bit more about Rawls, MD. Then we are going to get into today's topic, debunking Lyme misconceptions. We will discuss it at length. We will also have Q&A today after our discussion, and then be sure to hang in there at the end. We also have some special offers and resources to tell you about. So if you're not familiar with Dr. Rawls, he is the founder of Rawls, MD, and also the medical director of Vital Plan. If you've not been to our website, Rawls, MD, there are so many educational resources, blogs, and videos. Be sure to get signed up on our newsletter. We also have so many downloadable guides and resources for you. Dr. Rawls is also the founder of Restore 180 and the co-founder of Vital Plan. Dr. Rawls is also an author and has two best-selling books, including Unlocking Lyme and The Cellular Wellness Solution. And also, as I mentioned earlier, he is the creator of Restore 180. You may have seen Dr. Rawls on some of these podcasts and resources, including Tick Bootcamp, LymeDisease.org. He recently did a series of episodes on the tick chicks as well as with the Global Lyme Alliance. So he certainly is the authoritative voice when it comes to herbal therapy. Let's bring on Dr. Rawls now, if that's okay, before we get into this big question. Dr. Rawls, please join us.
Hey, Liza. Hello, everyone. Good to see you.
Good to see you. I'm so glad you made our webinar today, Dr. Rawls. I know you've been doing so much traveling and really working the podcast circuit, and I'm just so glad you're here.
Yeah. Well, yeah, out there, I seem to have picked up a virus traveling around, and so that's why my voice is a little gravelly. And but I really leaned on the herbs yesterday, and I bounced back pretty quickly, so I feel great. So yeah, we're ready for a great webinar here.
So excited. I wanted to share this question with you because we actually asked people as they registered, what is the biggest challenge or question you have right now when it comes to Lyme disease or chronic illness? And interestingly enough, we had a big percentage of people say that the uncertainty around treatment was a really big challenge, as well as neurological issues, neuropathy issues, and of course, fatigue and exhaustion. And so we definitely want to hit these areas today, especially when we talk about myths and misconceptions. And I think a lot of it too around treatment uncertainty. And like I said, some of those myths that we hear. Why is it, Dr. Rawls, that the conventional approach to chronic illness is failing people today? I imagine that's why people wanted to tune into this webinar. So what's happening? What's the missing piece?
It's this is a question that I've been exploring for my whole life, really. I mean, medicine was in my family. I used to go on house calls with my grandfather, and before him, my great grandfather was a country doctor. I never met him, of course, but this idea of what the medical system is designed for. And really, it's always functioned best for acute intervention. And chronic illness, managing chronic illness is something that we've only done in the latter part of the 20th century. It's only after the 70s that we actually started managing chronic illness. So before that, it was treating acute illnesses, treating infections, treating pain, treating broken bones. And that's really where we still shine is acute intervention or acute intervention for a chronic problem. In other words, somebody might have a chronic problem of atherosclerosis and, bad arteries, but we can't really do anything about it until they develop a clot. And then we might be able to save their lives. But we really can't fix the vascular system. And so when you look at our management of chronic illness, where it falls short is we're treating the manifestations, we're treating symptoms, we're treating inflammation, we're treating other things that are part of the inflammatory process, but we're not getting to the root causes of the actual problem. So people don't get well, and 60% of our population is chronically ill because of it.
Yeah. Yeah, no, exactly. And let's just go ahead then and start. Maybe this is a big myth. Maybe you need to speak to this because I know everybody here has symptoms and they want relief from their symptoms. So
Yeah.
I think there's kind of a misconception out there that if I just find the microbe that's causing these symptoms, I just need to kill that microbe and I'm good.
Right.
Is that a very narrow view of what's happening here? What's that missing piece?
Well, again, it gets back to the acute versus chronic. So when someone has an acute infection, so I don't even use the word chronic and infection anymore. That's not really appropriate. So an infection is when you first get a microbe, when something first enters your body through a tick bite or a respiratory infection like I got, or whatever. That thing is just coming to the body and it's an assault that microbe is trying to break into your body and the immune system is trying to keep that from happening and you get symptomatic from it. And it's so usually how it works is either the microbe wins or your immune system wins, one of the two. But when you look at chronic conditions like chronic Lyme disease, the microbes have typically been in a person's body for a long time, years, months, a long time. And they have developed a presence that they become ill-fitting residents in your tissues. So it's like your body is just kind of accepted that they're there and can't quite get rid of them. And so it's a defect in the body's ability to get rid of the microbes. But by then, it's typically not one thing. It's things that you've picked up in your whole lifetime that start reactivating, like mycoplasmas and chlamydias and Epstein-Barr and all of these other things that you hear about. You didn't get those from a tick bite. You picked them up all through life. And that's how it happens. We pick up a lot of stuff. And then when the body is stressed, these things start to reactivate. And that's what chronic Lyme disease is. So it's not chronic Lyme is not an infection. It's reactivation of things that have been there for a good while.
Wow. Wow. I bet you that's resonating with a lot of people. And that must be the reason why things like antibiotics, 21 days of doxy, that's why it wouldn't necessarily heal you or help you recover because just as you laid out, it's not an acute infection.
You got it, Liza. I mean, I was just reviewing the CDC recommendations that really just to appease people, made a recommendation of taking 200 milligrams of doxycycline, one dose if you get a tick bite and you live in an endemic area. Well, it's kind of like who doesn't live in an endemic area? But they don't want to give somebody a full course because if people get frequent tick bites, they'd be taking antibiotics all the time. The evidence is just not very good that it does much of anything. And the problem with antibiotics for these kinds of things is that it's not the right therapy to solve the problem.
Mm.
So when you look at, I was having this conversation with a researcher the other day. This was about a drug that is used for malaria. And they were saying, well, we can just use this for babesia and it will work fine. Well, the drug had a lot of toxicity, a lot of toxicity. And that's the problem. When you look at a synthetic antibiotic, whether no matter which one it is, you have issues with it. There's toxicity. Within 10 days, you start disrupting gut flora. Within 10 days, you start generating antibiotic resistant pathogens. So you're on a time limit. You've got a very short window of time. And synthetic antibiotics, no matter what type they are, work best for fast growing microbes. So looking at malaria compared to babesia, malaria is very fast growing. It can basically explode inside the body. So you need something really potent to get a handle on that really fast. And if you do that, you've got that short window that you can use that potency to control that thing. So babesia grows at a rate that's like 5 or 10%. Well, malaria, it's really slow. And I've come to appreciate that that's a defense mechanism. And it's a defense mechanism that Borrelia and Bartonella and all of the tick-borne microbes and many, many other microbes use as a defense mechanism that allows them to persist inside the body, to become those ill-fitting residents. And so when you apply that, when you try to use these really potent therapies to kill these really slow acting things, it doesn't work very well. And so you have to use them for a long time, which compounds the toxicity. So when you look at this problem, synthetic antibiotics, especially when we look at the thing we're calling chronic Lyme disease, just really aren't a very good solution to fix the problem.
Yeah, it makes perfect sense the way you explained it. It's not a good fit. They're not a good fit for each other. Um, and and a lot of people end up then feeling much worse than when they even started the antibiotic. I know a lot of people end up in those shoes.
Yeah. Well, that was me. I mean, I had been sick for a couple of years and kept looking for answers and finally got a positive test for Borrelia and like this is the answer. And I took one course after another of antibiotics and every course. About 2 weeks into it, I would just be sicker and sicker and my gut would be wrecked. And I tried probiotics and everything else and I just got worse. And my situation forced me into considering herbal therapy as an alternative because I had just run out of options completely. And it worked. It did everything I needed it to.
Yeah.
So
And
when you look at tools, it's just a better choice.
yeah, and I know we're going to dive into that too. And let's get to that. But before we do, you had mentioned how you had finally got tested. I know that there's a lot of people here trying to get tests, waiting to get tests, trying to find a doctor who could get them a test.
Yeah.
Is that a myth too? Is it a myth to say like, once I get the right test, and maybe they need to improve the test, then I can have the right diagnosis and then I can start feeling better? Is that a misconception?
Yeah. I was going through this 20 years ago, and for me, arriving at that conclusion that I had that particular microbe in my body was verification enough of what I was dealing with, because before I'd just been going with a diagnosis of fibromyalgia. So there is some value in verification, but the problem is the testing is only fair at best. So all the testing is designed for acute infection. And I didn't get a positive test until after I got another tick bite with a bullseye rash.
Yes.
And so, I had been sick for a long time and I had actually was getting a little bit better and I ended up with another tick bite and got sick again. And it was like, oh yeah, this has got to be what it was. So the testing is really designed for acute infection. If you've got chronic symptoms, and you've been sick for a long time, you don't you're gonna have a lower potential for getting a positive test. So even at its best, it's only 90% good at its very, very best. And I was looking at some of the statistics for the two-tier system that the CDC is advocating, and it's like 36%. It's just not really good at all.
Right.
Um, so testing, it's not a necessity. I mean, I always ask the question, if you've got someone with the full spread of all the chronic Lyme symptoms and they have a negative test, they still have at least a 10% and possibly greater of still having Borrelia. But even then, I know that there are a lot of other microbes beside Borrelia that can cause these same symptoms, that we have a lot of stuff in our system. It's much more complicated than we realize. A lot of things that we picked up in life can cause these kinds of symptoms. So, what if you don't even have Borrelia and you have all those symptoms? Well, the treatment for all of these things is basically the same. So when we get into how the best approach to solving this problem, it doesn't really matter whether you have a positive test or not. And so I think it depends on your situation, but I do know that testing can cost a lot of money. And I've seen people spend thousands and thousands on testing that really did nothing to forward their recovery or get them what they need. What people are hearing though is, oh, if you think you have Lyme, you need to get tested and you need to go see a doctor to get antibiotics. And it's just the wrong answer if you've had symptoms for a long time.
It's so true. It's so true. It's a chronic condition right now.
Right.
So let's dive into the chronic, like how this whole chronic situation comes into play, because you really are the authoritative voice also when it comes to talking about dormant microbes reactivating. You are like literally one of the first, if not the first, talking about it. So we have this piece to unpack, this dormant microbe reactivation, as well as cellular stress. You wrote the book on it. Cellular Wellness Solution, literally wrote the book on it, Dr. Rawls. So explain to everybody, let's get a little lesson here. Explain how these two things work together to
Yeah.
create chronic illness, chronic condition.
It's what I'm getting ready to say sounds simplistic. But it took me 20 years to get here. And it's such an elegant explanation for not only chronic Lyme, but virtually every chronic illness. And as my research has forwarded, as I pulled together more and more data of research that's being done out there, I'm much more secure in this being a very accurate answer to the problem. And, it's basically this. Our body is made of cells. We are cellular organisms. Everything that happens in the body is due to the actions of cells. If you have a symptom, it's related to cellular dysfunction. And generally, whatever that symptom is, that type of dysfunction is going to tell you what kind of cells are being affected. It has as much value as any labs. So, cellular stress, cellular dysfunction is central to every aspect of every chronic illness. Whether you're talking about inflammation, symptoms, abnormal labs, it's all rooted in cellular stress. So, our cells are like little microscopic machines. Um, each one of our cells is an independently functioning unit. Our heart is not a unit, it's a composite of billions of little heart cells working in synergy to make our heart beat. But each of those cells is an independently functioning unit. All of our cells came from one cell, so they're structurally similar. So every one of our cells needs the right nutrients, a clean environment, downtime and sleep to recover, good blood flow from exercise, and our cell's arch enemy are microbes. So when we talk about this thing of infection, you always ask, what does a microbe want to get inside our body for? And It's the answer is it's got to survive. It's got to have nutrients, food, resources. And that's what our body is. That's what our cells are. So we have our immune system that protects us, but also we have barriers, our skin, the lining of our gut. All of these things are designed to keep microbes out. So what an infection is a microbe crossing a barrier. So last week, I had a respiratory infection coming in through the mucous membranes in my throat. That's, respiratory there. We define respiratory infections because that's the entry point that they choose. Ticks, they like a tick, they travel with a tick bite. But what they all want is to get to the bloodstream because the bloodstream is the highway to all the cells in the body. So that's what they want. And that's how they do damage.
Right.
And so, if our immune system has built-in immunity, something crosses a barrier and it can stop it cold. So, when you look at something like Ebola is very devastating because we have no built-in immunity. There's nothing to stop it. It enters the body and just ravages cells. It's very fast growing. Most things that are threatening are very fast growing, and that's where things like vaccinations and drugs are really important. But when you look at tick-borne microbes, man, humans have been bitten by ticks since the beginning of time. We have built-in immunity. So their strategy isn't to try to overwhelm us. Their strategy is to get inside and make a presence. So they can just wait it out until we get bitten by other ticks, and then they can get on board and spread to another host. That's what they do. So they're not trying to overwhelm the immune system. They're trying to bypass the immune system. So just learning sophisticated mechanisms that all these microbes have picked up. So when they enter the bloodstream, they're getting through the bloodstream into cells in the body very, very quickly. And when they do, they invade cells. And when they can invade cells, if that cell is healthy, and here we're talking about brain cells, heart cells, cells in our nervous system, our joints, everywhere, they disperse. Think of your body as seeded by microbes every time you've gotten any kind of infection. So, this thing that I'm dealing with right now, and I'm just about over, I'll have a little presence of that for a very, very long time. Now, my body is healthy and I'm taking herbs, so I'm not going to feel it, but it's there. And so, this is happening every time you have something. And so, we pick up a little piece of it. And if our cells are healthy, these things can stay dormant for years and years and years. But your body gets stressed from trauma or not eating a good diet or chronic stress and not sleeping like I was. Then these things reactivate and they start breaking down tissues. And because different microbes invade different cells in the body, they have preferences for different cells. Different things reactivating in different places causes a widespread of different symptoms. That's why this same model, I'm finding connections to multiple sclerosis, Parkinson's, virtually every chronic illness and cancer too. You start to see the essence of this present. So it's a big deal. And
Yeah.
it's a different understanding of chronic illness that opens the door for practical treatment pathways that can actually lead to wellness.
Yeah. And it's interesting because you did pick up, some bug but your body with the herbal therapy and your lifestyle, you have healthy cells, at a cellular level, your body is healthy. But somebody else who maybe is in a place of poor cellular health, they potentially could pick up the same bug that you picked up.
Yeah.
And this could like tip them over. Is that I know you've mentioned the term boiling point before. And sometimes people can just be like one infection away or one, traumatic episode away from just tipping over. And then one day they wake up and it's like, I have all this joint pain. I can't walk up the stairs anymore. So is this kind of the dynamic that's happening?
Exactly. Yes, and it is. And I am to the point where I am confident that we all have basically a reservoir of different kinds of things that we pick up. There's more and more evidence pointing toward that way. And these things are present in our system. And when we're stressed, they can reactivate. So sometimes that's a small amount, and your body controls it again, and it goes back in its box, and that symptom goes away. But when somebody becomes chronically ill, what's happening is that they've had cellular stress to the point that it's allowing this widespread microbe reactivation. And once the microbes reactivate, they emerge, they start invading other cells, they start stressing other cells, which allows more microbe reactivation, and you get in this vicious cycle. And that's what chronic Lyme is. But it's also what a lot of other things are too. So yeah, so I call that the boiling point, the point that the microbe reactivation is driving cellular stress enough to further accelerate the microbe reactivation. And it's hard to get a handle on, and just an antibiotic or any other Lyme procedure that you might do is probably not going to be enough to completely take it to control the situation.
Yeah, yeah. Okay, so we've learned boiling point, and I'm sure a lot of people out there, could probably recognize what your boiling point was. And we understand now cellular wellness and the health of our cells, and we've talked about dormant microbes reactivating. So we're learning so much now, right? This is so different. But now tell us, Dr. Rawls, how do herbs come into play? Why herbal therapy to address this?
Yeah. I think it's important to compare things. So when I first started taking herbs, I thought, I didn't have high expectations. And it was like, if they really have any antimicrobial properties, if they can kill the bug that's making me sick, then it's going to wreck my gut and do all the things the antibiotics do. And it's over the years, I've just learned that we're talking about two different things, apples and oranges. They're just not the same. So, synthetic antibiotics, and by the way, all of our synthetic antibiotics were either from a natural source or pulled or mirror a natural source. We don't just make things up, in a chemistry labs. So, synthetic antibiotics are single agents. They're one chemical and there's no intelligence about it. It's just a random killer. It kills specifically certain kinds of bacteria, viruses, or whatever. Um, but it also kills our normal flora. And so you've got three big problems with synthetic antibiotics. One, they disrupt gut flora, and all it takes is 10 days to start really doing a number on your gut flora, even if you take probiotics. They generate antibiotic resistant pathogens. Let me tell you, this is a big deal. 1 million people die every single year of antibiotic resistant pathogens. And it's all due to the fact of overuse of antibiotics, both in humans and livestock too. And so a lot of people, it's becoming a very serious problem. And single agent antibiotics are toxic to our cells. And I can tell you, you can't get well with something that's toxic to your cells. It's as simple as that. So compared to looking at the herbs, all plants have antimicrobial properties. They have to. Everything in every living organism has to defend itself against viruses and bacteria. Even bacteria have to defend themselves against bacteria and viruses. So everything has to have a defense system. And plants, unlike our system, which is a cellular immune system, plants have a chemical immune system. So when we take an herb, we're getting this sophisticated, complex system made up of hundreds or even thousands of chemicals that have broad spectrum activity against a wide range of bacteria, viruses, protozoa, yeast. But interestingly, it's specific for pathogens. And I actually found a scientific study that proved this
Wow.
and that was the thing that really got me as I was getting all these benefits, but my gut was getting better instead of worse. That was kind of strange. I didn't expect that. But it's because the herbs target pathogens but don't disrupt your normal flora. You don't want to hurt your friends, right? So, and herbs don't generate antibiotic resistant pathogens. So, in this big problem that we've got with antibiotic resistant pathogens now killing 1 million people a year, herbs may be our best hope for solving that problem. Um, the herbs, unlike antibiotics, which are toxic to mitochondria and cells, herbs are really very protective. All these other chemicals actually protect cells from all kinds of different stress factors. So it's really, when you're looking for an ideal solution to solve this problem, because they have such low toxicity, you can use them for a long time. You're not restricted to that window that you're going to get cumulative toxicity of the antibiotic. So these slow growing things that are reactivating intermittently, you can just keep the pressure on for months or years. I've been taking herbs continually for 20 years and just had nothing but benefits. So it's a completely different option,
Yeah.
and it's one that we should be utilizing a lot more, not just for chronic Lyme. I mean, every herb that I've reviewed has been studied and found to have anti-cancer properties. I mean, who doesn't want that, right?
Absolutely. So then why is it, do you think, that conventional medicine or conventional doctors are not, why are they overlooking herbal therapy?
Yeah, it's just trained biases. We're trained doctors are trained in acute intervention, and so we use very, very potent drugs that have targeted interventions, and they just discount the value of herbs because they don't understand how they work. They've never been trained to understand it the way that I just explained it. So they discount the value of them. It's just not in their toolbox, so they don't have it to use. And if it had not been for my unusual experience and then studying it for 20 years, and I'd feel the same way. But you tend to use what you've been trained to use. And most doctors, once they get through training, our whole system now is based on protocols. And
Mhm.
all the medical training is sponsored by the drug company, so they're trained to use medical drug protocols, and they don't really know about anything else to use.
Yeah, it's true. It's true. So that's so good to understand about the herbs, that it's like a spectrum. They are antimicrobial in nature. Sometimes people want to attach this herb to this bacteria, and it doesn't work that way, right? It's a spectrum, and they have intelligence. The plant has intelligence. But when we talk talk a little bit about this, Dr. Rawls, in terms of cellular health, what else can the herbs do? Not just, covering, giving you antimicrobial coverage, but what about like the adaptogen component?
Yeah, I've started using that word adaption a lot for our antimicrobial herbs. And by the way, different herbs have different characteristics depending on the problems they have to solve in their environment. It's like some herbs are really good antimicrobials because there's a lot of stress in their environment, like cat's claw from the Amazon. But other herbs like rhodiola, which is a really nice adaptogen to help us with physical stress. It's native to Siberia, cold, harsh environment. Not a lot of microbe stress there. It has some antimicrobial properties, but they're not that good. But for physical stress, that's what it has to deal with. So, yeah, it's really good for helping us for that. So, adaptogens are herbs that have low toxicity, so they can be taken for a long time. A true adaptogen has chemicals in it that balance our stress hormones, so it helps us overcome stress, which is really valuable. And all of the adaptogens have sulfur protectants, which include things that actually modulate immune system functions. So adaptogens are really valuable. Um, then there are herbs like Japanese knotweed, andrographis, cat's claw, Chinese skullcap that we talk about for Lyme. They're not true adaptogens because they don't have quite the effect on the HPA axis and affecting stress, but they have all these other properties of protecting cells and balancing immune system functions that I've started calling them adaptogenic antimicrobial herbs. And I think it's a really valuable term. And that differentiates them from some herbs like echinacea or elderberry that actually have immune stimulating properties. So if you're using something chronically, you really don't want immune stimulants. You want things that balance immune system functions. So the herbs that we're using in chronic Lyme are immune modulators. They're balancing immune system functions.
Thank you. Thank you. That is so good to understand and know about. So I know that people are probably anxious to move into the Q&A section, Dr. Rawls, because I know there's a lot of questions. But before we do that, I really want to talk about symptoms. They're so vast. Anybody who has chronic Lyme or a chronic condition, it's very natural to be focused on our symptoms and wanting and seeking symptom relief. And so there is this myth of, I need a medication for this symptom, or this is the medication that will heal me. So what do you want people to know about symptom chasing or symptom seeking? What is the right type of mindset that we need to have about our symptoms?
It is it's a big deal. I mean, having symptoms is not fun. And who doesn't want to just go into a doctor's office and get a pill or a shot and walk out and feel great the next day? What I've learned though, it just doesn't work that way. Again, getting to back to that model of cellular stress, all symptoms are related to cellular stress. That's what a symptom is. So when you have a symptom, there are two components of a symptom. So when cells are stressed, if there are enough cells that are stressed, like if you have heart cells that are stressed, those heart cells release chemicals that activate nerves that send the message to the brain. So you feel pain. Or your joints or your muscles, those cells are telling your brain something's wrong, so you feel pain. But the other side of it is when cells are stressed, they become dysfunctional. So you start to lose that function. Your heart starts to beat irregularly, or you just don't have the strength that you did. So when cells are affected throughout the body, that's when you get symptoms like fatigue and things like that. So the only solution that will completely resolve a symptom is to stop the cellular stress. And that takes time because here what we're talking about is healing. The ability of cells to recover from stress and regenerate is what the healing process is. So certain cells, like our skin cells, you cut your skin, it's pretty good at regenerating. It's really fast. Heart cells, because they never stop beating, and brain cells, which are constantly working, they don't have much downtime. It takes them a long time to regenerate. So, part of solving the problem and getting over the symptoms is stopping the assault of the microbes, creating an environment that allows cells to recover and regenerate. But again, for certain things, like especially neurological symptoms, that can take a long time. So, short of that, and what we do in conventional medicine is to try to block some of that dysfunction. So you can block that response coming from the cells to the brain. You don't feel the pain anymore. You can do that with narcotics and other drugs, but it doesn't solve the problem of cellular stress. And it's true, like you can take gabapentin for some of your neurological symptoms, and it will block some of that abnormal response, but it's not going to actually fix the problem. So I get it. Symptoms are not pleasant, and I think sometimes drugs, medical therapies, other kinds of things that might block that symptom and make life a little easier for us or help us sleep at night, those things are all important. But know this, there is no drug made that can solve the problem of cellular stress because they don't get to the root causes. So all drugs for symptoms, all they do is block the symptom. They don't actually fix the problem. So that's why it's so important to do that comprehensive approach, what I call a complete approach of stopping the microbe stress, but also restoring, creating an environment inside the body that allows cells to recover so you can actually have your symptoms resolve.
Yeah.
I had a lot of symptoms. I had bad heart issues, neurological symptoms, my joints were shot, muscle pain continually. And over a several year period, it all gradually faded away completely.
Yeah.
So I didn't treat the symptoms, I treated the cause of the symptoms, and the symptoms gradually went away. So I think that's a misconception that's really, really important for people to recognize.
Agree. Thank you so much for going into that. Well, why don't we take some questions now?
Awesome.
I see one that we are going to answer live from Paul and Marilyn. And they just say a friend was put on Doxy for a tick bite due to undergoing a dental cleaning, and he believes that Lyme was wiped out, but the Doxy opened it up, maybe multiplied in the bat, and maybe reemerged. Reactivated a dormant microbe. First question, could that happen, Dr. Rawls? And second question, are there a lot of microbes in our mouth? Because we hear a lot about dental procedures, kind of tipping that boiling point for some people.
Yeah, again, give me that question again.
It's for the first
Was
question
it
here.
antibiotics and it worsened the dental infection or?
He believes that the Lyme disease was wiped out, but the doxy opened him up to a multiplication of bad bacteria from the dental deep cleaning that had gotten into his blood. Is there a way to avoid this type of complication when taking doxy after a deep cleaning?
Huh. Well, that is one of the problems with any conventional antibiotic is it disrupts flora, not only in the gut, but the mouth, the skin, and everywhere in the body. And yeah, you taken enough, and it didn't wipe out all the Lyme. I promise. It did not get all the Borrelia. Again, they're slow growing. I'll mention that again. It's like different kinds of infection. You get a pneumococcal pneumonia, those bacteria are turning over every 20 minutes. That's how quickly they double. Borrelia in its most active stage, 12 to 24 hours. It's really slow. So I don't think any amount of doxycycline ever completely eradicates them. Again, their goal isn't overwhelming your body or overwhelming your immune system. It's getting past the immune system and entering your cells and going dormant. And so, how much of your symptoms were actually residual Borrelia and how much of it that they're of other pathogens that had been generated, it's kind of hard to say. But there's no doubt every time you get your teeth cleaned, you get a big shower of bacteria in your system. No doubt about it. They used to put people on antibiotics that had valve issues, like valve replacements, heart valves. They don't do that anymore because they were not finding that it really did any much. So I'm not surprised. Um, you know, um, I'm sensitive to those issues, and I actually use toothpaste with tea tree oil and neem and other herbs in them because they suppress some of the more harmful pathogens in the mouth, but they don't disrupt your normal flora. And my teeth, my gum health has been a whole lot better since I've started doing that. And teeth cleaning, it's partly just keeping your teeth really clean so the cleaning isn't so abrasive when you get it done.
Okay. Thank you. I'm going to look, I saw this question that Jordan had asked in the chat, and then I'll go back to Q&A. And he says, Dr. Rawls, can the vital plant herbs also treat a chronic streptococcus bacteria infection in the body? And Jordan's probably referring to Restore 180, which is your 6-month protocol. I think when people say, does Vital Plan do this? So specifically, would Restore 180 treat chronic streptococcus?
Yeah, it depends on what you're talking about here. All right. So Streptococcus, we've always thought of as an extracellular bacteria that basically attacked cells from the outside, not as one that invaded cells and became dormant inside. And I was studying pandas, a condition that kids get that affect it causes behavioral conditions.
Right.
And it typically occurs after kids have been treated for strep throat with antibiotics. And retreatment with antibiotics can actually make it worse instead of better. I actually found studies that showed that Streptococcus can invade cells and become dormant and can slow its growth. So it's one that would be typically a faster growing bacteria. And so like if someone, if you're in a situation where you've had some health challenges and your tonsils have gotten infected with strep and you've got some abscesses, draining the abscesses and conventional antibiotic treatment can be really important. But so in that case, sometimes it's a combination of different kinds of things, and sometimes acute intervention. I mentioned that. That's where we're at best. Sometimes you do have to have your tonsils removed because they get so infected and there's so many bad pockets that you can't get rid of it. But excluding that, looking at situations like pandas or kids that are just having chronic strep, we're talking about a situation where strep is invaded cells, it's gone dormant, it's slowed down its growth. And in those cases, the herbs can actually, keeping that pressure on long term with your herbs can actually be a very, very reasonable thing to do. Um, yeah, and it's not a track that a lot of people have used for pandas at this point or chronic strep, but I think it is a very practical use, and we've definitely had some kids respond.
Yeah, even my own kids responding so well to herbal therapy and Vital Plan. So absolutely. Dr. Rawls, this is because you had mentioned antibiotics. So here's a question from Katia. Um, she asks, do you start taking antibiotics before starting herbs right after being tested positive for chronic Lyme? So here, now people are asking, like, should you just do the antibiotics for 10 days and follow up with herbs? We kind of get this question a lot. What would your advice be?
It depends on the situation. If you have an acute tick bite, you get a sick tick bite, you become symptomatic. I think it is reasonable to follow the CDC recommendations and do the 12 days I think they recommend of doxycycline. But don't stop there because I don't think it eradicates the Borrelia from your system, unlike what you hear infectious disease doctors say. I don't think so at all. And 20% of people go on to get chronic symptoms. I think it's actually higher than that. So I don't think Borrelia ever wipes it out. I mean, I don't think doxycycline ever wipes it out completely or any other single agent antibiotic. So I strongly recommend that people use an herbal product for weeks or even months, especially if they're symptomatic. It's a very, very reasonable alternative that is low risk and it makes a lot of sense to do that. But that's for an acute tick bite. Again, if you're it's a chronic situation and you've been sick for months, years, whatever, and you don't remember a tick bite or didn't get sick around the time of a tick bite, and now you've got chronic symptoms and you tested positive, I think antibiotics are not only a waste of time, but it actually may be the very worst thing you can do.
Yeah, could definitely prevent recovery and prolong the illness with all the things that you discussed of, how it can disrupt your flora and everything. Okay,
Yeah.
thank you, Dr. Rawls.
Yeah, I just wanted to add to that, Liza, and
Yeah,
just say
please.
one more time. You know, the last new antibiotic was created when I was in medical school in 1985. That's the last one. We've had no new antibiotics. There's been resistance to every antibiotic made. We're using them indiscriminately. We have been for years. Antibiotic resistance is an enormous problem. It doesn't occur with herbs. A million people die every year, and that's growing. Every year, it's getting worse. So anytime somebody uses an antibiotic inappropriately, or especially if you're using an antibiotic long term to treat a chronic condition, you're actually contributing to that problem.
Thank you. Thank you so much, Dr. Rawls. It's so important to stress. Can't stress it enough. This question came up twice. What are your thoughts, Dr. Rawls, on frequency machines and or Rife machines? I think sometimes people are trying to look at other, non-antibiotic
Sure.
ways. And so what are your thoughts on these things?
Yeah, I did not use a Rife machine. I studied mm, frequency, microcurrent frequency, um, and just trying to understand. I pretty much reviewed everything out there. I kind of have a hobby of reviewing the latest Lyme therapy out there. Rife machines have been around for a long time. I can't imagine that they actually work of how people think they are supposed to work, and it doesn't go along with Rife's original research. This idea that you're going to find the microbe that's making you sick and you're going to dial in a frequency to kill that microbe in your body. I just don't buy it because, we have 40,000 different species of bacteria that we know of. There are many species of Borrelia. We actually have species of Borrelia that live in our mouth and other parts of our body that are part of our normal flora. So this idea of dialing in a frequency to a specific bacteria out of tens of thousands, and the fact that you have never just Borrelia, you still have the possibility of different species of Bartonella, Babesia, Mycoplasma, Chlamydia, Epstein-Barr, on and on and on and on. I just don't buy it.
Got it.
So why do people feel better? I think it's actually the energy. So what you're doing with microcurrent therapy or right is you're introducing energy into the body, right? So what inflammation is a low electron state. It's a deficiency of electrical energy. And when our cells are starved for energy, they're low on electrons. So when we're giving through putting electrons in the body or putting energy in the body, like with red light therapy or PEMF or Rife, we're introducing energy into the body. And our cells can use that energy. They pick it up, it energizes mitochondria. And when cells have more energy, immune cells, our regular cells, they can recover better, they can do their jobs better. So introducing energy and even like microcurrent, what you hear about with grounding, just walking across the ground barefoot, you absorb electrons into your body, or sitting on a pad that is grounded to the earth, you're getting electrons. So there are a lot of ways that you can pick up electrons, and I actually think that's what's happening. I don't think we're killing microbes. So yeah, I think if you want to do it, the problem with them is they're really expensive. You can spend $5,000 or $10,000 for a Rife machine, and you know, it's a lot of money. I've never heard of somebody. I've talked to a lot of people that feel better, but they have to keep doing it. They don't. It's not a cure. So
Got
it's.
it.
But that's my take on it.
Okay, we appreciate that, Dr. Rawls, truly, very much so. And I know we're coming close to time. So I just have one quick question, real quick question for you, Dr. Rawls. And I know a lot of people have questions for Restore 180, so don't you worry. We have a lot of resources for you, and lots of follow-up for you. But Dr. Rawls, for people watching right now who are kind of stuck, what is the one piece of advice that you would leave them with today?
Yeah. I think the big thing is shift away from thinking about this like an acute infection and think about, these bacteria are in our tissues, in our cells. It's not just Borrelia, it's a lot of other microbes. They're reactivating, and if you're chronically ill, you've passed that boiling point. And the only way to get well is suppressing the microbes while simultaneously restoring cellular health. So you need a complete solutions. Most things I see out there, IV antibiotics, ozone, hyperthermia, all of these things I consider partial solutions because they're not solving the whole problem. And people get some better, but then they bounce back and they don't get well. So herbal therapy combined with lifestyle and other interventions to create that environment that promotes cellular wellness, that's a complete solution that ultimately is going to get you better than anything else you can do.
Yes, thank you. Thank you so much, Dr. Rawls.
A
And
pleasure.
yeah, thank you. And if you are still with us, we have so many resources and some follow-up information to share with you. Please make sure you follow us on social media. We have big news next Thursday. Dr. Rawls's episode with a major podcaster in the space will be live. I think you can continue learning more about cellular wellness and dormant microbes and all things healing. So be sure to follow us on social media. That episode will be live next Thursday. If you are not part of the Vital Plan Network, we invite you to join the Vital Plan Network. And I will be launching a new back to school series on September 8th. In this series, Dr. Rawls will be giving you more information, more content in quick lessons. So 7-10 minute sound bites a couple days a week so that you can further educate yourself on cellular wellness and your pathway to recovery. We're also going to dive deeper into Dr. Rawls's book, Cellular Wellness Solution. So that might be the book that you want to grab for free. And we'll also read a couple chapters together. We're going to do this in community. So be sure to join the Vital Plan Network. We also have an app you can download. It's available on Google Play and also the App Store. So come join us. And everybody who was on Restore 180 also has a premium space where we provide you with all the information on Restore 180. And also on the Vital Plan Network, we have Dr. Rawls's free course, Jumpstart Your Recovery. This might be something for you to take today and get started. If you want to learn more about Dr. Rawls's program, Restore 180, please set up your complimentary phone call with myself or with Vital Plan Health Coach Paulette. We will answer all your questions on the protocol. So I know that they're going to be dropping in a URL in the chat, and you can schedule that complimentary call. If you need to dive a little bit deeper before looking into the protocol, you can also schedule a 60-minute health coaching call with one of our health coaches. And just some next steps, be sure to check your email. The replay will be available, and you can share this with friends. I know that there was a lot that we unpacked today, so you can watch it again. It'll be available in your email and also on the Vital Plan Network in the next day or two. Thank you so much for joining us on today's webinar. Hope you learned a lot. We are here to support you. So be sure to get Dr. Rawls's book, Join the network where you can be part of our back to school series. And also don't hesitate to book your Restore 180 phone call. Thank you so much, everybody. Wonderful seeing you all.
Thanks for joining us. Take care.